my name is Samantha Smith. I'm going to be showing y'all some injection sites today. First, I'll just give you a little show around the room and my environment to make y'all know that I'm not cheating. Alright, so our first injection site is going to be the deltoid muscle. So for this, you're going to have your patient relax. And you're going to want to find the acromion process, which is that bony prominence coming out of the shoulder. You're going to want to go 3 finger breadths down from that, and you're going to want to create a V, and your insertion site will be in the middle of that V into that deltoid muscle. Now you're going to want to go in at a 90-degree angle because this is an intramuscular injection site, and your needle size should be about a 1.5 inch needle, but for intramuscular injections, you're always going to want to use your nursing knowledge and assess the size, the gender, the age of the patient, and determine an appropriate length of needle for it. And the gauge would also be dependent on the viscosity of the solution and it would just be dependent on the viscosity of the solution, but it would be about 22 to 25 gauge needle for that. So the next site that we're going to show you is the dorsolateral aspect of the arm. This is a subcutaneous injection site, so the landmarks for this are going to be 3 finger breadths up from the olecranon process, which is just the elbow, and then 3 finger breadths down from the insertion of the deltoid muscle. That's going to give us a tiny rectangle here to work with. You're going to want to pinch that subcutaneous tissue, and depending on how much subcutaneous tissue you pinch is going to determine your needle size. So if you can pinch 1 inch of subcutaneous tissue, you're going to want to use a 5/8 inch needle. If you can pinch 2 inches of tissue, you're going to want to use a 1/2 inch needle. And the angle that you would go at is determined by how much tissue is present and the size of your needle, because you want to inject into that subcutaneous tissue. Alright, so next I'm going to show you all the abdominal injection site. So for this, I'm going to lift up your shirt if that's okay. So for this site, we're not going to want to go above the costal margins, and we're not going to want to go below the pubic area. Laterally, we're also not going to want to go past the anterior superior iliac spines. So that's going to give us about this area to work with. We're going to want to go 2 inches from the umbilicus. So this site is good if you want to rotate injection sites, if you have multiple routine injections. So for this, you're going to want to pinch 1 inch of tissue. If you can pinch 1 inch, you're going to want to use a 5/8 inch needle. If you can pinch 2 inches, again, you're going to want to use a 1/2 inch needle. And again, that angle is going to be determined by how much tissue you can pinch and the size of needle that you're using, either 45 or 90. You just want to be able to inject into that subcutaneous tissue. So next I'll have you roll towards me. We're going to show you the ventrogluteal injection site. This is an intramuscular injection site, so it's going to be at a 90-degree angle. So we're first going to find the greater trochanter, and if you can't find it, you'll just bend the leg and you'll be able to feel it. So you'll put your palm on the greater trochanter, your thumb points towards the groin, and your first finger will go on the anterior superior iliac spine, and your second finger will be on the iliac crest. Then you're going to want to palpate and make sure that you are injecting into muscle and not bone. And then you're going to want to insert at a 90-degree angle. And for this, you want to use about a 1.5 inch needle. But again, you're going to want to assess the size of your patient, age, gender, and all of that. Next, we're going to show you the vastus lateralis. So if you will lay back on your back for me. And the first landmark for this is also going to be that greater trochanter. So I'll again have you bend your knee. Alright, so once you find that greater trochanter, you're going to want to find 1 palm's breadth down and then 1 palm's breadth up from the knee. And this is going to give you a large rectangle to work with. You're not going to want to go past the midline of the thigh in like that way, and then you're not going to want to go past the midline of the lateral aspect of the thigh. So that's going to give you a pretty large rectangle to work with, and you're going to want to use the middle thirds of this so that you're injecting into that muscle. Again, you're going to want to inject at a 90-degree angle into the muscle. And for this site, you're going to want to use a 5/8 to about 1-inch needle, depending on the size of your patient. This site can also be used for subcutaneous injections. Again, you're going to want to assess the amount of subcutaneous tissue that is present, and this is going to be on the anterior aspect of the thigh. But the injection angle is going to be determined by the amount of tissue present and the size of the needle that you have. So that wraps up our injection sites. Thank you so much. That's all.